Have you ever wondered what a real professional fitness test actually involves? I mean, it's way more than just stepping on a scale or timing yourself on a quick run. So today, we're going to pull back the curtain on the science behind a comprehensive health and fitness assessment. We'll break down exactly what the experts are measuring and, more importantly, why it all matters.
But before we dive into the nuts and bolts, let's start with a big question. What does it actually mean to be fit? Is it how much you can lift, how far you can run, or is it just about how you look in the mirror? The truth is, it's way more complex than that, and a professional assessment is designed to give you a real, scientific answer.
So why even bother with all this formal testing? Simple, because it moves us from just guessing about our health to actually knowing. It gives you an objective, data-driven snapshot that, let's be honest, you're just not going to get from looking in the mirror.
And the reasons for doing it are pretty powerful. First, testing gets you that crucial baseline data. It's the starting point for everything. With that data, a professional can develop an exercise plan that is completely personalized to you. No more cookie-cutter workouts. It also gives you concrete numbers to track your progress, which helps you set goals that are not only reasonable, but actually motivating.
A real pro assessment actually starts way before you even think about breaking a sweat. This whole preparation phase is all about making sure the tests are going to be safe, accurate, and tailored specifically to you.
And then number one priority here, safety, always. That means going through an informed consent process so you know exactly what's going to happen. It also means a health screening and a look at your medical history to check for things like cardiovascular disease risks. You'll probably fill out what's called a PAR-Q, a physical activity readiness questionnaire, just to make sure you're good to go. Think of it as a thorough check-in before the actual checkup.
And get this, the room itself plays a huge part. All the equipment has to be perfectly calibrated for accuracy. The tests are set up in a very specific order, so you're not overstressing one part of your body. Even the room temperature is controlled, usually a comfy 68 to 72 degrees Fahrenheit, and the space is kept quiet and private. It's all designed to reduce any anxiety and help you perform your best.
Okay, so before any of the real work starts, we need to grab some fundamental baselines. This is pretty simple stuff. Your resting heart rate, your resting blood pressure, plus your height and weight. These numbers might seem basic, but they form the foundation for everything that's about to come.
All right, with all that prep work out of the way, we get to the core of it, what we can call the 4 pillars of fitness. These are 4 totally distinct but also interconnected components that, when you put them together, paint a really full picture of your physical health. Let's take a look at each one.
First up, we've got body composition. And right away, let's be clear, this is not just about the number on the scale. This is all about what your body is actually made of, the ratio of fat mass to all your fat-free mass, like your muscles, bones, and organs.
Now this is where it gets really interesting, and honestly, super important. It turns out that where you store body fat matters a lot. You've got android obesity, the so-called apple shape, with more fat around your middle. This is linked to a much higher risk for health problems. On the other hand, you have gynoid obesity, the pear shape, where fat is stored more in the hips and thighs. And this is a perfect example of how specific and powerful this data can be. For young men, if their waist-to-hip ratio is greater than 0.95, that's considered a very high health risk. It's a super simple calculation, but it has some really powerful implications.
So you might be wondering, how do they actually measure this stuff? Well, one of the most common ways is with skin fold calibers. The idea behind it is pretty straightforward. The amount of fat that's right under your skin is directly related to your total amount of body fat. It's a pretty accessible method for getting a solid estimate.
Let's move on to pillar number 2, cardiorespiratory fitness. And folks, this is a huge one. Why? Because having low levels of cardio fitness is directly linked to a higher risk of premature death from everything, but especially from cardiovascular disease. So yeah, it's a big deal.
The gold standard here is something called VO2 max. It sounds super technical, right? But the analogy here is perfect. Just think of it as the fuel efficiency of your body's engine. It's the maximum amount of oxygen your body can suck in and use when you're going all out. A higher number basically means you've got a more efficient engine. So, how do we test this? Well, there are a few really common ways. We can start with something called field tests. These are great because you can do them with minimal equipment. Sometimes just a track and a stopwatch, like timing a 1.5-mile run. They give you a fantastic real-world estimate of your fitness. Then for a more controlled approach, you've got treadmill tests, usually in a lab setting.
Here, the speed and the incline of the treadmill are slowly cranked up in stages. This lets a professional see exactly how your body responds to increasing demands, which gives a much more precise picture.
And finally, another super common and accessible method is a step test, like the 3-minute YMCA test. It's simple. You step up and down on a platform to a set rhythm. But it's really effective for assessing how your heart not only responds to the work, but just as importantly, how it recovers afterward.
All right, on to our third pillar, muscular fitness. And this is so much more than just, having big muscles. It's absolutely critical for things like maintaining your bone mass, helping your body manage blood sugar, and just being able to get through your day-to-day life without getting hurt.
Now, muscular fitness really breaks down into two key parts. First, you've got muscular strength. That's the absolute max force you can generate in one big effort, like a 1-rep max lift. And then you've got muscular endurance. That's your ability to do something over and over again, like seeing how many push-ups you can do before you just can't do another one.
And that brings us to our fourth and final pillar, which is flexibility. To put it simply, this is just the ability to move a joint through its full pain-free range of motion. It doesn't get as much hype, but it's so important for your overall movement quality and preventing injuries.
So, we've gone through and measured these 4 different areas. What now? Well, the real magic happens when we take all of these individual data points and put them all together to create one single holistic view of your health and fitness.
And here it is, the whole shebang. A truly comprehensive evaluation weaves every single step we've talked about into one cohesive picture. You start with the safety pre-screening, you get your resting baselines, and then you systematically test all 4 pillars: body composition, cardiorespiratory fitness, muscular fitness, and flexibility. This is how you get a true 360-degree look at your health.
The American College of Sports Medicine puts it perfectly. They say these tests provide a wealth of information. And that's exactly what it is. It's not about getting a score. It's about deeply understanding your body's current functional status, because that's always the first step to making it better.
So there you have it. You know the what and the why behind a professional fitness assessment. The only question left is the one that really matters. If you could, what would you want to learn about your own fitness?